Thanks for joining me on Menopause Unscripted. Remember, the change is just another beginning. Welcome back to another week of Menopause Unscripted. I am Dr. Heidi, and I'm joined this week by Lorne Brown, a new friend of mine who lives up in Vancouver. Lorne is the podcast host of the Coherence Code, which I'm going to ask you to explain what that means here in a minute. And he has more acronyms after his name than more than anyone I've probably seen in a while. So, Lauren, could you please explain to me, number one, what the Coherence Code means? And second, could you tell me a little bit about the myriad of letters after your name and what all things you integrate into your clinical practice?
Sure. Let's start with the Coherence Code. So previously known as the Conscious Fertility Podcast, coherence. People might be familiar with heart-brain coherence, right? So when things are in coherence, we experience vitality and joy, and when we have incoherence, noise, we're not feeling so good. So when I originally started the podcast, my goal or my intention was it was going to be called Conscious Talks. And a
Okay.
colleague of mine said this conscious work is really important for the demographic you see a lot, fertility. So you should call it the Conscious Fertility Podcast. And I said, I don't want to do that. I want to talk about consciousness and coherence. And he was into like channeling and all that fun stuff. And he really put it on. And I go, I'm really suggestible. I go, fine, I'm going to call it the Conscious Fertility Podcast, but I'm going to interview people about quantum physics and consciousness and psychoneuroimmunology. So eventually we switched to the Coherence Code Podcast because anybody can benefit listening to those episodes when we talk about consciousness and quantum healing, for example. But when somebody who's in menopause or not trying to grow their family sees conscious fertility in the title, even though the talk isn't focused just on fertility, they may not listen to it. So we realized half our listeners weren't trying to grow their family, and many people were missing out on these episodes because fertility was in the title. So that's why we switched it. And really, it's just coherence. People, go into AI and stuff, you'll hear coherence. It's just about this idea of healing heart-brain coherence. Actually, we're going to talk about low-level laser therapy. Lasers is coherent energy, right? It's coherent. LEDs
You're
are
gonna have to fully
incoherent.
explain. You're gonna have to fully explain that to me here in a minute.
So we'll talk all about it, but in the end, it's really, I still wanted to call it Conscious Talks, and the people that
Mhm.
work with me said it's going to be the Coherence Code, and that's great because we talk so much about heart-brain coherence in the spiritual world, quantum world. So it resonates. So it resonates, which is coherent energy. So that's why
There
it's
we
called that.
go.
You
So
want to know
how did
my?
you get, I
Do
want to
you
know
want to
about
know
your
the?
background and
Yeah.
I want to know how you became so interested in this because it's fascinating, but what was your arrival at wanting to do this with your life?
So when you asked about all the acronyms in my name, so
Hmm.
my early career was a chartered accountant or CPA, and
Okay.
I had health issues, and it was from these health issues that eventually I started exploring other medicines. This is back in the 90s, so alternative medicine was the term, and eventually it was Chinese medicine that made the biggest shift for me. It was actually the herbal medicine because I had a fear of needles back then, so
Okay.
it was herbal medicine, and it changed my life. I had chronic fatigue, candida, irritable bowel syndrome. I was struggling with my health, and tried everything and scoped from through the mouth, through the rectum. I had everything, and I had you shared on my podcast TMI, so I figured I might as well share it all here, let it all hang out,
Please.
right, Heidi?
Yes.
So I had a lot of symptoms, and it wasn't until it came I got a little bit more serious where it's still unexplainable, but the symptoms were even visible for the doctors. But nobody could help it. I tried different meds. So, long story short, Chinese medicine made a difference. Eventually, I left my position. I was a controller and tax guy for some of the Ocean Spray growers. People know Ocean Spray, the cranberry drink. I had left public practice and was in private at that time. And I went back to school. And long story short, again, a woman came to me going through IVF in around 2002, and I was able to support her. And then she told some friends. And by 2004, my practice was pretty much just reproductive health.
Okay.
Um, and because Chinese medicine is about the mind body approach, We were trained like barefoot doctors, though, in North America. So I knew how the mind affects the physical body. But Chinese Cultural Revolution, they kind of pulled out the spirituality of the medicine. So I went and got trained as a clinical hypnotherapist so I could bring the mind back into it. And then later I found teachers. I founded a company called Healthy Seminars, which does education for professionals, and especially naturopaths and acupuncturists, and brought in the classics again from teachers and really integrate that into my practice. So as of now, I have a clinic called Acubalance. It's in Vancouver.
Okay.
We have naturopathic doctors. We have doctors of Chinese medicine. We go on site at the IVF clinic here, the largest one probably in Canada, definitely in BC, where we offer IVF acupuncture and IVF laser acupuncture on site. And the main women are demographics we see are men and women, but predominantly women because women seek out healthcare, not men. So the men I see, by the way, Heidi, when I ask them, why are you here? They say, my wife told me to come. That's when I ask them. So what brings you here? My wife said I had to come. So we see a lot of fertility still, but perimenopause and menopause. And that's because I've been in practice since 2000. And
Mm-hmm.
during that time, the population that I used to see for fertility are now all perimenopause or menopause. And my wife's
Mm-hmm.
in that age, she's in her early 50s. So, and it's something that women are asking about. Like it's pretty loud and out there and looking for it. In Chinese medicine, um, fertility and perimenopause and menopause, the underlying cause and imbalance are actually so similar. They just manifest differently, symptoms in menopause versus infertility, but the treatment is not very different. So it's not a stretch for a Chinese medicine doctor who has a good experience and knowledge treating fertility to help somebody with perimenopause, menopause. Actually, my women who are 43 that have night sweats and irregular cycles and um, maybe some diminished ovarian reserve, they're in perimenopause. The only difference between them and a patient that comes in for perimenopause is the perimenopausal patient is happy when her night sweats, hot flashes, and cycles become regular, where the fertility patient gets the same relief, but she's not satisfied until she's pregnant.
Okay.
So, and the mental emotional part comes from somewhere around 2010. I've been in practice since 2000, so 26 years at the time of our recording. I had a little bit of burnout happen in 2010, and then by 2013, I had debilitating anxiety,
Oof.
and it did not make sense. Like I actually thought I had a very serious disease, because my life was good. I had a great clinic. I have healthy seminars. I got healthy parents, siblings, cousins, family, my children. Like there's nothing on the outside world that could explain why I had this. So um, I ran all the batteries of tests and couldn't really find anything to make sense. So I was pretty convinced there my body's saying there's something wrong because it was hard to get out of bed. It took all my resources to be present with my patients. If a patient wasn't having a good day, I had no resilience. Like it would just exhaust me and put me into full anxiety just in life. I couldn't handle anything. So it was debilitating. It really impacted my life. And because of that, I was always interested in spirituality and consciousness, where they call it now today, consciousness. And I found a teacher here, and I just made it like became my priority. I became like a PhD student in consciousness and waking up. And I did a bi-directional approach. So I still took care of my physical with IV therapy, acupuncture, herbs, laser therapy, and I worked on the mental emotional. I realized it was bidirectional and I needed to work on the physical to contain the work I have to do with the trauma inside my cells. So I needed to have that capacity to do that. But I had to deal with the mental emotional. And I was aware that what was happening to me, I saw in patients that were older than me when I was a younger practitioner in their 40s, that all of a sudden, somewhere around 40, and it's a generalization, what used to work for people, their antidepressants, the supplement, the acupuncture, it used to work and work for months or years. Now they give them relief for an hour a day and then something else would pop up. And I realized somewhere around 40, people have these wake up calls, and it's kind of like the body or the soul saying, okay, all that stuff that's happened to you intergenerational or from your childhood that we've parked aside so you could survive and function, you're 40 now, you got to deal with your shit. And it just comes up and it does not let you ignore it. And so that was my experience. So I became the patient. And through becoming the patient, being a kinesthetic learner, I went and got more certifications. That's why there's so many things after my name. Some people, I'm a kinesthetic learner, so I don't like just to read about something. I usually go and get a training in it. So I became a clinical hypnotherapist, trained in emotional freedom technique, trained in Psych K, Banks and Healing method, immersive peer transformational therapy. So I just keep learning, and I like to do a deep dive in these different modalities because I like it for myself. So selfishly, I like how I feel and how my life has changed because of it. And I like to share it with my patients. And my approach or my way of viewing the world and my patients is it's the spiritual or the mental, emotional that is the missing link in healing, I believe. I think we're all getting pretty good at the physical, taking certain supplements about movement. Nobody has to be taught about diet anymore. Most people know what they may not eat the right diet, but they know what is good and not diet. So we're pretty good at the physical and doing things for the physical, but the spiritual trumps the physical. And if your mindset and your subconscious programs are aligned, then the physical and the actions will follow and you'll have good health. But if you're eating well and you're exercising well, but you have real negative self-talk or you have old trauma, it's going to wreak havoc underneath. It's like a smoldering fire. You're in LA, you can appreciate this. It's like smoldering underneath, and then a wind comes, and then the flames come up. But it's always underlying smoldering, waiting for that external event in your life to just stoke the fire. So for me in my practice, because I have many associates at Acubalance, um, if you want to just work on the physical, I just want acupuncture and laser therapy and IVs, just work on the physical, you see my associates. If you want to do that and you want to address subconscious programs or people call, I don't use the word trauma, overwhelm that's stuck in the tissues, then people see me because I'll bring in the acupuncture, laser, herbs, supplements, diet. I do the physical, and we go and work on the subconscious programs.
So before we met, you had introduced me slightly to a program you called NAC.
Right. It's a process that I use.
Could you please walk me through that? Because this is nothing that I had heard about, and I thought it was so fascinating and was super useful for people here that aren't seeing you to hear about, and whether they work with you virtually, which I believe that you do,
Yeah.
or if they're seeking out something here, just being aware of what that acronym means and what that entails.
Yeah. So notice the sec choose again. It's a process. And so when I was doing my searching and then my training experience, I realized all these teachers of consciousness, some had 10 steps, some had 2 steps. But one day it just really dawned on me that they were all doing the same thing. Notice, accept, choose again. So I'm talking about the Terra box, people know radical acceptance. I'm talking about the Joe Dispenzas, the Eckhart Tolles. I looked at any book or any program I would do, David Hawkins. I'm just giving you guys the names that are into this material,
Sure.
the letting go, the surrender. I realized it's really simple. Notice, accept, choose again is how this healing happens and how you get into this aspect to get you out of sympathetic fight or flight into parasympathetic rest and digest, where you heal, creativity, reproduction. And what I realize is when you fight with reality, you create resistance. When you're fighting with what's happening, resistance comes up. And when you have resistance, we call that chi stagnation in Chinese medicine.
Okay.
You don't have flow anymore. And when you have chi stagnation, you get pain, and over time, you get disease. So the key here is when they say acceptance or surrender, they don't mean resignation. They mean don't fight with reality. And so I'll explain each step, but this process, I'm a left brain guy. So remember, I'm the accountant first, a bachelor of science in math. So when I read Eckhart Tolle's book and he talked about the power of now and how you can be at peace, with there's no more suffering when you're present, the power of now being present. I was like, I really like this. How do I get some of that? Right? Like, how do I
How do
do
I get
this?
there?
How do I get there? And I wasn't that person that would enjoy sitting on a pillow for an hour in the morning. That wasn't who I was. That was uncomfortable for me. I couldn't slow down the thoughts. Actually, when I would meditate or go on holidays, when my mind would get busier with ideas and creativity. So I learned how to do to get into being, and then you do again. There's where the choose again comes from. So I'm going to unpack all this, but I I I realize that you can sometimes do to get into presence, and that presence is the sweet spot. And I can talk about it from a Newtonian perspective, and I can talk about it from a quantum perspective. But the first step is to notice. Notice everything that happens is neutral. Everything is neutral and we give it meaning. We are meaning makers. And this is a form of awareness. So, meaning makers, meaning that we see the world through the lens of our subconscious programming. It was inherited. We didn't choose it. You came into this world, meaning you actually, there's intergenerational trauma. We know this through the mouse studies, we know this through Holocaust research, that trauma lives in our tissue, right? So you see the world through the lens of your subconscious, and then your economic status, your religion, your gender, what country, who your teachers were, you're getting imprinted on. So now when you see the world, you are perceiving it through a lens. It's not the true reality, meaning that if reality is white snow, how do you have blue glasses? I have pink glasses. This person has red glasses. We're all looking at the same thing, but we all have a different experience based on our lens. And if you change the lens, your experience changes. So the first step, it's the most important step, because you have to notice that everything is neutral and you give it meaning. When you believe in the story, you make it real. When you believe in the story, you suffer. You're at the effect of it. So now we've made the unconscious conscious. That's notice. That's not enough. It's not enough to know that you're triggered. It's not enough to know that you run a program, because the program still runs when you are unconscious, right? And so knowing is not enough, right? You have to do process work. You have to metabolize these uncomfortable programs and feelings. So you cannot positive think your way through this. You can't do that spiritual bypass. That's like having stinky garbage in your kitchen and you keep spraying Febreze. You may do a little affirmation, and for an hour it smells good, but then the wretch comes back because the garbage is still there. Okay, so what this is in the accepting phase is it's a form of process work. It's work. It's you're metabolizing it. So you're going to take out the garbage and you spray the Febreze, but now the wretched doesn't come back because you undid the program. So acceptance is a form of surrender. It's a form of letting go of what is. It doesn't mean I'm not saying you like it. I'm not saying you're resigned to it. We're just saying in this moment, you're no longer fighting with what is. This is the secret sauce, because in that acceptance, resistance drops. When resistance drops, you reconnect to your higher self or your hope. Let's just put it from a real bio Newtonian. Newtonian is not the complete reality of our reality, by the way. We have in our reality, we have two dimensions, a Newtonian one and a quantum one. They both exist. So you got to be able to hold them both at the same time. It's not one or the other. But let's talk about Newtonian for those that are materialists. So when you have resistance, you can put yourself in the sympathetic, because you're not safe. There's resistance. You're fighting with reality. So you're sympathetic. So you mobilize energy for survival, right? That means those resources aren't available for healing, creativity, and in this case, reproduction, right? When you fully accept and the resistance drops, now you've freed up resources for healing, creativity, and reproduction. You've gone from that limbic system when you're in fight or flight resistance because you go into survival mode into whole brain. Now we know through research at UCLA, when they do gratitude practices, you are accessing parts of creativity in your brain that you normally don't have access to. It's kind of like the mathematician, the person is trying to solve a problem and they're frustrated and they're getting mad and they're in resistance, they can't solve it. And they're like, enough. And they go for a bath or go for a walk. You know, we talked on when we swapped, you went on the walk. And now that they're not trying to figure it out, they have no resistance. There's a letting go there. They're not, the idea pops in their head because they went from limbic to whole brain and now they have access to more. Some people believe you actually tap into superconscious, something outside of your brain. right? So that's the key of acceptance. The key is resistance drops. And when resistance drops, you now have flow and receptivity, and therefore inspired thought enters through you now. And there's choose again. Now, right action follows right thinking. So before action to me, I'm cloned. I could have two clones doing the very same thing. One is coming from fear and lack, one is coming from feeling whole and complete. The action's the same, but the beingness behind the action is different. You'll get different results. It's not the action necessarily that's going to determine what comes back at you, it's the beingness behind it. So in notice, accept, choose again, notice I'm triggered, right? Make the unconscious conscious. Then there's all these tools and processes in the accepting: EFT, Psych K, EMDR, the rapid eye. There's so many things you can do in that inner child work, parts work, all that stuff in the accepting. And then once you're at peace, how do you know this? When the resistance drops, you feel it. The contraction turns into expansion. The tightness turns into a softening. You feel relief. And now you're whole brained, and now choose again. So right action follows right thinking. And so that is the notice, accept, choose again process that I teach with my patients. And I keep getting these different credentials because all these different things I learn can fit into NAC. And these are just tools that fit into it. And if you do it long enough, I've been doing this since, like, really actively, purposely, since 2014. Now, when something happens, I can get triggered. But before I'd get triggered and I'd go unconscious and totally go into reactive mode, now I can sense it happening in its slow motion where I can interrupt it. And this comes from, this idea that in every situation, you either unconsciously, habitually react, or you can choose to consciously respond. NAC interrupts that story so you can consciously respond versus unconsciously, habitually react.
I'm going to steal this from you. I'm just going to tell you, like, I'm going to start integrating this with my own patients because I think it's incredibly useful. And that was so easily understood. All I could think about was rotting bananas in in the garbage, and how those babies just got to go outside. No Febreze is going to cover those up, but
And that's what affirmations do. And there's a place for that,
yeah.
by the way. But if you don't get rid of the garbage, if you don't get rid of the program, then they keep showing up. And the work and the people I work with remotely or in person. So think about this. This is what makes it fun in my practice. So they're on the table, and I have the InHarmony vibroacoustic sound table. So they got vibration and binary beat music happening. So it bypasses the brain to allow the vagus nerve to get activated and put you into that alpha state, right?
Hmm.
Um, they have acupuncture, which induces, more alpha state as well, alpha brain waves and that parasympathetic. And then we're bringing up their stuff and we're working it and we're taking up a relationship with it. So rather than trying to avoid it, you lean into it. And when we had you on my podcast, you talk about this endurance and resilience, or you said it perfectly, being comfortable, being uncomfortable. And so I always ask, are you willing to feel your uncomfortable feelings? Because we actually fear, we fear the fear of the feeling more than the actual feeling. And when you actually lean into it, and that's where I share tools to lean into these feelings, you're like, I can handle this.
Yeah.
Like, you still don't like it, by the way. There's a part of you that doesn't like it, but you're no longer, like, now you no longer need to control the external world. And you asked a question earlier, how to get into this is, my teacher, my first real, I've had many teachers, but my first real teacher, she's in her 80s here in Vancouver, Gila Golob. Um, it kind of hit on me that this is all inner work and that it takes a lot of energy to try and change the external world. I have this lens. And so I need my wife to be a certain way, my parents to be a certain way. I need the government to be a certain way. I need politics. I need everybody to be a certain way. That's a lot of energy. If I can change my lens, everything shifts. So I was like, I can make me a project. I'm just one person. That was exciting. I could do this. And so with my patients, they come in with their story, and we only use the story as the trigger. There's no room for blame here. There's no room for
Hmm.
victim. It's all about being accountable and responsible. If I'm feeling triggered, that means it's inside of me. meaning that there's this great poem about what did you put in your coffee cup? And so when somebody bumps your elbow, what you spill out is what you put in. It's not the person's fault who bumped your elbow. If you put coffee in, you spill out coffee. If you put in tea, you spill out tea. If you put in water, you spill out water. If you put in anger, you spill out anger. If you put in compassion, you spill out compassion. Yes, the person who bumped your elbow caused you to spill, but what you spilled out is all on you. So they're just
That's fantastic.
they're just the trigger. And so if you don't have that in you, it doesn't matter what happens in the external world. You don't get triggered by it. And so you can literally be at peace in an unhappy situation. And in that, choose again to summarize the Power of Now author Eckhart Tolle. He says, when you're present, which is what NAC does, it puts you into present moment. When you're present, you can either consciously remove yourself from the situation, consciously change or improve the situation. And if you can't remove or change or improve it, then you can continue to accept what is, surrender to this moment, because you can be at peace in an unhappy situation because there's no resistance. Peace in an unhappy situation. Remember, you're not spiritual bypass. I don't care. I don't pretend. No, you're aware you don't want or like the situation, but you're not attached to it being changed. So in this moment, you're at peace. So it's kind of like in this moment, I'm at peace. In this moment, I'm at peace. In this moment, no resistance, flow and receptivity. In this moment, at peace. And then all of a sudden, out of nowhere, inspired thought comes through you. And now you take action. So you may not be doing much, but you're at peace. There's nothing you can do about it. You're at peace. You're not being called into action. So you're not, remember, it's not an habitual reaction. It's a conscious response. So you're choosing to respond. So you may not be doing anything. You're just witnessing it, but you're at peace. It doesn't mean you don't feel sadness or anger. It just means you don't amplify it and it does not cause resistance. Resistance is what's uncomfortable. If you feel sadness and you're present with it, it's peaceful. There's a bliss to it.
Let's talk about how that could be applied to somebody going through a fertility battle. Because I think that before we even get into the other parts of that, but how could someone apply this to like a fertility struggle?
Mhm.
And if they're trying to create and expand a family, and then how could we also apply this same concept to someone going through perimenopause and the menopausal transition to make that both experiences easier, knowing that when we're trying to conceive a family, trying to grow a family, the more we're in that sympathetic fight or flight, that's going to make it harder.
Yeah.
And the more we're resistant to the change and transition that is our hormones as a woman, it may make amplify and make these feelings worse that everyone complains about.
Sure. Well, let me start with an example.
Okay.
And if I feel free to interrupt and ask some of those questions you asked, because there's a couple
Yeah.
there so I can stay on track. So here's an example. Woman in her 30s diagnosed with premature ovarian insufficiency.
Mhm.
And in her case, when she came to see me, she gave me all her blood work and she's not ovulating. Like she is
Okay.
not ovulating. Her IVF clinic, the reproductive endocrinologist, her FSH is incredibly elevated. And when they did the ultrasound, she didn't have an antral follicle count. They didn't see any follicles, and her AMH is undetectable.
Okay.
So, not a very good prognosis. And when she came to me, IVF was not an option for her. She was considering adoption. And she wanted me to do whatever I can do to help her. And I shared that um, this if you're looking for a miracle, we're gonna have to do conscious work because and again, in the Joe Dispenza work, there's matter to change matter. That's like using the physical supplements, IVF, and then there's energy to shift matter. This is where it's quantum, where it's beyond space and time. And I wish I could explain it beautifully, but let's just say I shared with her that she had other, there's things that she wanted to work on. And I shared that I can't promise you a baby. So I did not promise her a baby. I did share with her that your scenario is like buying a lotto ticket for every winner, because she's seen cases on our website, people like her. And I said, for every winner, there's a huge line of people that did not win the lotto, right? So it's not impossible, but highly not probable. But you can't win the lotto if you don't buy a ticket. So I made sure I didn't go, we're going to make it work. And the whole idea is to bring you to peace, whether you have baby or not. That's my goal. And to give you the physical support to give you the best chance. But did not sell her, this is going to work, but we can make it so I can share with the conscious work, if it's successful, that you're at peace. And I'll add this, that when people do this work, myself included, that one of two things happen. The first, always, if it's successful to work, is that your perception to the situation changes. So you're no longer at the effect of it. So there's the peace, wanting the child, but no longer attached, no longer, oh, you're now okay. Most of the women I see say, if I don't have this baby, I will not be okay. Right.
Right.
The second part is the perception changes. So you don't need it to change anymore, but that's when the external environment changes. And all of a sudden you have the healing, or you get the
Okay.
man, or you get the new job. Right. It's just kind of, but you don't need it to happen to be okay because your perceptions change. So in her case, I worked with her for 9 months. Remember, high FSH, undetectable AMH, no AFAC. And when I looked at her bloods, she's not ovulating. I started testing her progesterone. So we do conscious work with her. We're doing the acupuncture, we're doing herbal and laser. She's coming 2 to 3 times a week. And in her second or third session, she brought up trauma from her childhood, abuse from her
Okay.
childhood. So now we're using clinical hypnosis and this conscious work NAC process in it. She's doing wonderful using this, processing, metabolizing these emotions. She starts to ovulate. And she's being monitored by this IVF clinic. They get excited, so they give her some letrozole the next cycle, makes her cycle wonky. We continue to do our work. She ovulates, they give her more letrozole. And finally, I say, can you just have 3 months of no medication? Let's just, and I was thinking just intuitively, her body needs a break. By the way, I'm not pro or anti any stuff. Most of my patients are on meds, IVF, doing all that. It was just an intuitive hit with her. She's doing so well. We're working really on this psychoneuroimmunology idea, the mental emotional aspect of the body. And I just didn't want to physically, the body's starting to feel safe. It's opening up. She's processing, she's healing. And then we're forcing it to do something else. I was just like, we seemed, again, from observation, without any medical drug intervention, we seem to see the body coming online. And when we give it the medical intervention, it seems to go offline again. So I said, can we just have no medical other intervention for a period of time? Yes. Because remember, she wants this desperately, so she's willing to try everything. We continue. She's shifting. She's great. She says the line that I'm always curious when I hear it, but they're like, I still want this baby, but I'm okay if I don't have this baby. She's no longer attached, no more resistance.
Mhm.
Anyways, 9 months after treating her, she conceives naturally and she had that baby girl.
That's
Right.
amazing.
So that's that conscious work in it. And by the way, she contacted me again, and we did a little tune up, and she's had second baby. Um, one more case for you, if I may. Just
Thanks.
she came after an IVF with PGTA testing, so they did chromosomal testing. She was fortunate and unfortunate. Fortunate, she was 39. Fortunate that they were able to biopsy 7 embryos. So she got 7 embryos to blastocyst to biopsy, and all 7 came back abnormal. And
Oof.
she's a health professional. She came back devastated and quite anxious about it, and not sleeping well. Just she was so inflamed, just physically, that you could see, and emotionally. And she was desperate. She was sharing with me things she was going to do in Germany, like all these experimental things. And there's a lot of experimental, like meaning not high evidence, PRP, even low level laser therapy. But some of them have serious side effects. Some of them are enormously expensive.
Mhm.
And she was open to conscious work. So we do conscious work with her. She starts to shift. She's losing weight without counting calories. Her mood's changing, her sleep. She doesn't have these inflamed skin. She's just shifting. And then that magic word comes up on the table. We're working with her one day, and she shares that, I really want this baby, but I know I'll be okay if I don't have this baby. Like she had shifted.
Yes.
She conceives, she has this baby. Remember, IVF, 7 abnormal embryos. Does this work? This is 6 months later. She conceives, has this baby. She comes back to me after she has a baby a few months later to share that without trying, she was having intercourse with her husband after baby was born, and she got pregnant, not trying, but unfortunately she miscarried. And she says she really wants to have a second baby. And so I just reminded her, let's go over your supplements. We did herbs again. And I said, let's a tune up. Like, because people come back saying, I'm back to where I was. And I go, because you're in your story, right? They're in the lens is there, right? So
Yeah.
I said, I'm feeling pretty confident that after our hour together, you'll realize you're not that same person, and you'll go from unconscious to conscious. And again, do the session. You can see the shift in real time. She feels it, the relief. We do 3 sessions. She goes on to conceive baby number 2 now at 41 and has a live birth. So there's 2 examples of with fertility. It doesn't matter whether somebody's coming in for fertility, menopause, back pain, headaches. Some people come to me and say, they've had a psychedelic experience and they're traumatized by the psychedelic experience. Some people have bad trips. So we just go back in to see, remember the story of the coffee cup, whatever it is,
Yeah.
infertility, that's the elbow. Hot flash, that's the elbow. My husband says he's leaving me. That's somebody bumping your elbow. What comes out is what's in. Now you know what's stored inside of you. How you react is what's stored inside you. Life's going to happen, and how you react is all on you.
That is, and so with that being said, so like you started, like I want to just pause there for a second. How does that trauma or those lived experiences or that inside the coffee cup, how does that impact us genetically?
Yeah.
And how, by mentally making these changes, can that affect us genetically and perhaps flip switches, change our epigenetics to make improvements in our health and well-being, overall fertility, but otherwise just overall health and wellness?
Yeah, well, I can't remember the title, but a whole book's written on this by Bruce
Mhm.
Lipton called The Biology Beliefs, maybe. So there's
Okay.
so we know that the environment impacts genetic expression. And so your thoughts and feelings affect epigenetics and
Mhm.
basically how your genes function. So the idea, to use the expression, you know, the what pulls the trigger on the gun, right? So
Sure.
you can have a gun, but if nothing pulls the trigger, the gun doesn't go off. So you can be predisposed to diabetes or cancer or other Alzheimer's, but you need the environment to turn on the gene. There's a great experiment with the Gauti mouse where they were bred to be overweight, yellow, and diabetic, and and so that's what they were. And then what they did is through methylation changes, feeding the mice differently, putting them on their hamster wheel. All of a sudden, their offspring, although they had the gene to be yellow, overweight, to be diabetic, they came out brown and thin and didn't express it. So
And so that could affect some of the generational trauma that people have as well.
yes, because the intergenerational trauma is a tag on your genes. It's not you're not needing a 10,000 year gene mutation. It's tagged. So in the mouse study, the cherry blossom study, they shocked mice, and they made cherry blossom smell every time they shocked it. So they go into sympathetic. Those mice had pups, and then they had grandpups. So the grandpups were never shocked, and they never got to talk to grandma about it. But when they put cherry blossoms in the cage, the mice reacted like the electrical shock. So it got tagged Holocaust
Okay.
survivors. But you can take the tag off. So you can break the link. Interesting. I share the story with you about my debilitating anxiety when I came to a good place. Like many people at this Gila's work, they're good now. They got the job or their spouse or they got their healing. They stopped going, and they feel fine, right? I kept on going, and then they come back 6 months, a year later because they're back into their shit again, right?
Yeah.
I kept going, and Gila once said to me, she goes, "Why are you here? Just curious. You're here still. Your things are good." And I go, "Well, 2 reasons. One is, can I maintain it? Can I even go higher? Right? Like a professional athlete. Yeah, I know you're an
Right.
endurance athlete. Hey, can I maintain it? Can I lift even heavier? Right? Because being a heavy lifter." I also had children, and I could see some of their neuroses, my young children in me, and I thought I protected them from it. They don't know my story. I don't, and I'm like, how are, like, it's right in my face. Like, like, how are they exhibiting this? And there's the intergenerational stuff. So I kept doing the work, because when you heal, your whole constellation heals. That means your children benefit, your ancestors benefit. So so it gets passed down, passed down, passed down, and then you get to be the one to break the chain. You can break the link. And so that's why I continue to do it. So going back to your epigenetics, if you're constantly, when you have the stress hormones, so you got the cortisol and the adrenaline happening, then you're going to, inflammation, you're going to turn on genes for poor health and disease. If you have the oxytocin, serotonin, dopamine, the peace and feeling good, you're going to turn on genes for longevity and health. So your thinking, your negative talk, and your experience, your emotions are energy emotion, and they are chemical reactions in the body. And so if you're experiencing peace and joy, that's going to affect you on a genetic level, versus if you're feeling fear and lack and shame and guilt. And so we're very careful of what we put in our mouths. But this generation, with TikTok and Twitter and all the news and the biggest lawsuit eventually that I think will happen is suing the media companies with all the fear and hate and clickbait that they have shared to get us going. That's why media fast is probably one of the most incredible things you could do for yourself. So we started at the beginning. I changed my practice because I realized that you're thinking and feeling that you're doing every second all day long. You don't eat all day long, hopefully, has
Yeah.
more impact than what you eat and how you exercise. And if you have that shift in the thought and feeling process, you will tend to eat and move. It's kind of like right action follows right thinking. And so if you clean that part of your world up, you will want to move and do things. You'll start to make better choices, like attracts like.
Now, this would definitely work on reducing inflammation during the
Absolutely.
maturation cycle of of an egg, right? Like during that, like the final day maturation, is if I'm changing my thinking and I'm having those eggs come to that final maturity before ovulation, this would affect that health potentially and help to stop that cycle.
Yes, because let's just talk about the biology for this.
Hmm.
When you're in sympathetic, when you're in fear, when you do not feel safe, and as I said, the resources get mobilized for survival, we know that blood is diverted from the reproductive system. So there's less blood flow. So that will affect follicular genesis. We also know that when you have all this noise in the system, all this stress in the body, it's noise. And that hypothalamus pituitary ovarian axis, for those of you that go and your doctor says your bloods look fine, yeah, the signal's there. Think of a radio, but all that static, so you can't really hear what you can hear. There's music or voices on the radio, but you can't really make it out. So the signal's there, but there's so much static noise, you can't interpret it. So many of us have the hormones are there, but the hypothalamus pituitary ovarian adrenal axis has so much noise in it, your body's not getting the signal. Your history is different. You had somebody that cut the wire, the block, the brain was, you had a
Yeah.
structural thing. So that structural thing was affecting the communication, right? I'm saying that people have structurally, they can't find anything wrong. Hormonally, everything looks great. We're not good right now in our current medicine to measure the noise, right? Inflammation's noise, oxidative stress is noise. So if you chronically have cortisol levels in your body and adrenaline and epinephrine, it's like driving your car across, from California to Oregon with the engine in the red. If you do it to pass a car, when you pass a car, they say it's good for the engine to go into the red every once in a while on the highway. It helps it. So stress isn't bad. Stress is bad when it's too much in a short period of time or little over a long period of time. And so that long period of chronic stress leads to chronic systemic inflammation. So a fun term for this is inflammaging, which means that it turns into accelerated biological aging, which causes premature degenerative diseases. And I say premature fertility decline. So if somebody's looking to optimize their egg quality and they have a lot of stress and fear and tightness, and you know this as a PT, the tightness, then you got muscles contracting, interfering with blood flow. You're increasing oxidative stress. You're increasing inflammation. Your blood sugars go off whack, metabolic disorders. If you have severe metabolic disorder, blood sugars, we see this in polycystic ovarian syndrome, the number one cause of ovulatory disorders. But some people just have a subtle of that all the time, day in, day out. It's not so obvious as in PCOS. So yes, if you can calm the nervous system down, it's called psychoneuroimmunology. Your thoughts and feelings impact your nervous system, your hormonal system, and your immune system. All those things are important. Hormonal is important for fertility. Immunity is important for your fertility as well. So as we age, we lose blood flow to the reproductive system. So if you can bring blood flow in through relaxation, stress reduction techniques, breathing, exercise, that's going to help you. If you can calm your nervous system, feel safe so you don't have all those stress hormones, then the inflammation and the oxidative stress is going to go lower, because those things will negatively impact your fertility and uterine receptivity for implantation. So it's simple. When I interviewed you, you shared your 3 kind of things for health. So movement is key, right? And then that community, having support, feeling safe, having somebody to talk to, being seen and heard, community is important. And then outdoors and nature. There's so many simple things. Tie one more that can help with health. Going back to that mind body, because you asked this about epigenetics, Chinese medicine says the number one cause of diseases are emotions. Like it's written 2,000 years ago. That's the number one cause of our disease. And so when you have emotions where you're fighting with them, so you're not able to lean into them and witness them and allow them, when you can't be comfortable with your uncomfortable feelings, they create resistance, they create chi stagnation, and that leads to disease. I'm not saying you're happy all the time. The human experience is, if you're driving your car and somebody cuts you off and it scares you and it makes you angry, and a minute later you're happy again, present moment, the scare is over, the driver's gone, you had your anger, you're now safe again, your body's like, we're safe, and you're good. That's a healthy response. If 3 days from now you're still telling me how pissed off you are about the guy that cut you off, and you're being a, what do they call it, a Karen, and you're looking up, I got to
It's now
find this guy.
Jessica.
What's it?
It's now Jessica, apparently.
Jessica. So you're being a Jessica. You're like, I got to find that driver because I'm going to go protest at his house. I'm going to go. That's probably not healthy.
So, like, we're talking about inflammation, we're talking about blood flow. You mentioned both those things having to do with fertility. So let's use that as a segue to talk about low level laser therapy and how
Yeah.
that could also be used. Because this is something I had never heard about using as part of a fertility protocol to help women to have to more easily, or in another way, to have a tool for conception, until you and I talked maybe a month ago. And I know nothing about this. I'm here to learn from you. So please tell us more about what tools you use, how you would use it, and at what timing you'd recommend people start using it when they're working on a conception plan.
Okay. So timing, I will share, and I have a blog about
Mhm.
100 days. So
Okay.
just in timing for whatever modality, it's 100 days because of follicular genesis, that it's about a year of recruitment that your follicles go in before they're ovulated or retrieved in an IVF. And those last 100 days, so 3.5 cycles, maybe 100, 90 to 150, but those last 100 days is when they become responsive to FSH and get more blood flow, seems to be key, right? So timing is, everything's at least 100 days, just to let people know. It's not just a week before. For a woman, I just got my cycle, I'm bleeding now, so now I'll stop smoking, eating well for the next 2 weeks. No, because then only 14 days out of the 100 did you give the environment what it needs. And so you want to have at least 100 days is ideal. I'm going to share a proverb from Chinese medicine because it will tell you why I use laser therapy, all the things I use, the conscious work, energy psychology that we talked a lot about today. It says, nourish the soul. And I use this approach for all my patients, even perimenopause and menopausal as well, because there's a connection, relationship there. Nourish the soil before you plant the seed is the saying. And the metaphor I'll use is if you've had a plant, and tell me if you've had a plant that you neglected and it looked a little withered and dry, and you're like,
Happens.
needs to go to the compost, but you're like, you know what? I'm going to add water to it, pull some weeds, maybe give it fertilizer, even change how much sunlight it gets. Can you imagine, or have you ever done this and the plant regained its vigor and gave off fruits and flowers?
Yes.
Okay. So you didn't do donor roots for the plant, right?
No.
So the plant always had the potential to give off fruits and flowers, but because the soil was suboptimal, it couldn't reach its potential to give off fruits and flowers. So in this metaphor, the soil is the ovarian environment and the
Okay.
roots are your eggs, right? And so just like a plant, if there's weeds, there's toxins and contaminants, we got to pull away the weeds. Hey, if it's the soil is nutritionally deficient, then we need to eat a better diet or give it supplements. Hey, if it's dry and it doesn't have enough water, we need to increase blood flow. Hey, the plant needs sunlight, photosynthesis to create energy. Well, we get that from the supplement CoQ10 in our diet. Low level laser therapy does that, by the way. So everything is about the soil. Hey, if the pH is off, then we may want to play with the pH. Think of hormonal imbalances. So we got to balance the hormones. Or the microbiome of the soil's off, it could be an issue. So we got to work on the vaginal microbiome and the uterine microbiome and the gut mouth microbiome. So think of yourself as a living organism, as a soil, and you're made up of trillions of cells. So when I look at somebody and they come in and go, I'm fine, my doctor says I'm fine, and they have psoriasis all over their body, or they get migraines all the time, or they have insomnia, or they have diarrhea all the time, or they're constipated, or they're freezing cold. You know, if I try and put a seed in frozen soil, it does not implant, even though the seed is perfect. So we look at you as a like a tree. And if you have one branch that's sick, I don't think you have a root issue. It's a branch issue. You sprained your ankle. I don't need to go do integrative holistic treatment. I got to just work on your ankle. You hurt your ankle. But if you got psoriasis, headaches, or cold and constipated, that's a root issue. I don't go and try and fix each branch. I address it, but I realize there's an underlying root issue I got to deal with here. So when you ask the question, how do you practice? Integratively. So there's the mind body approach and the physical. And I use Chinese medicine as my way of diagnosing because it is incredibly beautiful, brilliant way to look at patterns. You know, in the West, for anybody who's Western trained, it's a syndrome. Chinese medicine is constantly looking at syndromes, right? They're looking at patterns. Very rarely one symptom in isolation is enough. It's like a puzzle. If I have one piece of the puzzle, I can't tell you what the picture looks like. But if I put together enough pieces of the puzzle without putting the rest of the pieces, without you telling me the rest of your symptoms or any labs, I can tell you what the picture is going to be. So we get enough symptoms that we create a diagnosis, a pattern. We get a picture of what's going on constitutionally. We address that. And then things you never told me get better too, because it was part of the underlying imbalance. So in my practice, my style practice is most people, well, everybody gets the sound table. They love the sound table. So that vibration to help get you into parasympathetic, to help the body relax, feel safe. Because when you do that, healing begins. I use acupuncture. I'll do herbs, supplements, dietary therapy. I'll use my conscious work. And then low level laser therapy. And if you want, we can focus on low laser therapy unless there's any questions on that approach.
I would love to kind of move on and focus on that because I think we've covered the other things pretty well. And I think a lot of people will be very interested in this part.
So there's a story behind it and how I came across, and I feel lucky. You know, you feel guidance. Like when I told you the NAC, like it landed inside of me. And excuse me, I've come to a place where I'm like, I used to think I would think up to certain things, and now I
Hmm.
realize I could become a receiver and things drop in. And now I'm like, thank you for that because it feels good to get a cool idea. Remember,
Yeah.
inspired thought comes through you. So the NAC came into me. It wasn't like I thought it up. It just wasn't there, and then it was there. So for the laser, my first introduction was a study came out in 2008 using laser acupuncture in an IVF setting. And it was laser acupuncture with a sham laser, with real acupuncture, and a control group. And the laser group outperformed everybody. It was a day 3 fresh transfer before and after the IVF transfer, and the laser group had a 15% increase in implantation. And the fact that it outperformed the sham laser made me think these points aren't benign, because if it was all made up benign, then the sham laser, the laser that really didn't do anything, should be the same as the real laser. But there was a statistical difference. So that was my introduction. And then because of that, I just, got interested looking more, and I came across Dr. Oshiro's work. And in Oshiro's, and actually before that, I found out, I read Norman Doidge's book, The Brainswave Healing, and a doctor in Toronto, Fred Kahn. He was working with women with a lot of brain injuries, TBIs, and health issues. And a couple of women had endometriosis and adenomyosis. And so in the book, he talks about using it for them, and they were able to not have surgery because their pain went away. So then I started really doing a deep dive. I actually he was not alive anymore, but I got to visit Fred Kahn and hang out and learn from him in his clinic. I got to shadow him from the people at Meditech Bioflex. And he taught me his protocol, because it wasn't an FDA thing. So it wasn't in the system program. So he gave me his
Of
protocol.
course not.
Right. Yeah. So he shared, this is what I do. Then I went to Australia. I went to Roberta Chow's clinic. She's a medical doctor, trained in acupuncture, trained in laser therapy. And in conversations after visiting her clinic, she had shared that many women with endometriosis, she would help become symptom-free, and they would end up going on to have children as well when they were having infertility issues. And I just kept on digging. I learned about Oshiro in Japan. This is a really interesting one, Heidi, is he was treating, he's a medical doctor, pain specialist. And so a woman came in who was she was in menopause, and she had back pain. And he would always do proximal treatment around the neck. So he would do stuff around the carotid, the vagus, statellite ganglia, occiput. And his reasoning was that by doing this treatment, you engage the parasympathetic, blood goes everywhere. So he would do this no matter where the pain was, because if blood goes everywhere, head to toe, if it goes to your knee, you'll benefit for your knee pain, and your ankle pain. In this case, this woman had back pain. Then he would locally treat her. So he treated her a couple times a week for several weeks, and her back pain got resolved. But she called him upset because her period came back, and she would have a bleed for a couple of days every 3 to 4 weeks for a couple of months. And he dismissed her, as many doctors do, and said, it's not my laser, but go see your gynecologist because you're bleeding. Make sure everything's fine. In that same calendar year, another woman with back pain who also wasn't menstruating anymore, he would do his treatment to bring blood flow head to toe, treat her back. Back pain was resolved. Her period came back. So then he said, blood flow everywhere. Maybe I'm bringing blood to the ovaries and I'm rejuvenating the ovaries. So then he went and talked to a colleague, worked in gynecology, and they did a pilot study with 74 women. The English translation was severe infertility. And I can't remember the exact stats, but so if this is incorrect, when you go look it up, I apologize. But from my memory, without having it in front of me, average age 39, 9 years of infertility, 15 ART cycles. Because in Japan, by the way, I don't know what it is now, but they don't do donor eggs there, homogeneous society. So they will try everything to help a woman get pregnant with her own eggs, because they don't have the luxury to use donor eggs. So there is no, it's time to do donor eggs. It's like, so they do acupuncture, they do supplements, they do laser. So they did this study, 15 ART cycles, and it was something like high 20% got pregnant, 68% live birth rate. Pretty wild for this demographic.
Okay.
They expanded it to 701 women, similar 23 pregnancy rate, 50% live birth rate. So to tie up the story, and then we'll talk about the mechanism, you'll start to see I'm like a dog with a bone. I know you have a dog at home. I don't know if your dog likes a bone, but I just can't let things
He does, and he's just literally laying right here.
I can't sometimes let things go. My patients appreciate this neurotic aspect of me, but I have to understand and learn. I shared with you, I'm a kinesthetic learner. So I've traveled around learning. I need to talk to Oshiro, right? I got to know more. I send a letter out using Google Translate. I write a letter, Google Translate into Japanese, and then I look for clinics in Japan that have Oshiro on their staff. and I
Okay.
send it to all the
All
clinics.
of them.
And I put on Facebook, does anybody know anybody in my acupuncture groups? Please let me know. I'm looking to talk to Shiro. Nobody responds. But an acupuncturist doing his PhD or master's at UCLA from Japan was in this Facebook group, and he speaks English
Okay.
and Japanese. And he says, I can connect you with a clinic in Japan that's does the Urshiro style and he works in an IVF clinic, and I'll be your translator. And I said, great. And I said, here's the letter I sent people. And he looks at it and he goes, in Japanese, there's a hierarchy in language, like how men and women talk to each other. And like, if you want somebody like a public versus doctor, there's a hierarchy. And he says,
Okay.
it's not surprising nobody responded to your letter. Like, you're asking a doctor, you want to talk to him and learn from him. This is not the letter. And I was like, hey, blame Google Translate, right? So
You're like, I had no idea.
I had no idea. So he finds me Dr. Nakamura. He's an acupuncturist in an IVF clinic. At this time, this is pre-COVID. He has over 10 years of data tracking people going through IVF, and he had shown through his research that doing his laser with acupuncture at least 3 months to 6 months, they had a doubling of blastocyst rates. So women that were going through IVF, even though they're getting older, when they did the low-level laser therapy with the acupuncture, they had a doubling of day 5 embryos blastocysts, where usually you get less. And interesting enough, I came up with a protocol. Remember, there's a Shiro who did the neck. When I talked to Roberta Chow, she liked to use the sacrum. Fred Kahn did the sacrum in the lower abdomen. What I left out is a group in Denmark with the Giga laser. I've interviewed one of their practitioners, Anne-Marie Jensen, who uses the Giga. I have the Giga. I think we're the only clinic still in Canada that has it in Vancouver. The Giga laser is big, 500 centimeters square, covers the whole abdomen, much more powerful than the laser Oshiro used. And it wasn't a study, but case studies that practitioners shared, pretty impressive success rates. And so I put together a program where I incorporated Oshiro, the Giga laser idea, Bachelor of Science accounting. It's all math when it comes to lasers. I took the systems. I worked with a couple of colleagues, Roberta, one of the doctors from the Bioflex system, and we played with the math, check my math to try and mimic the Giga. And we did sacrum, the lower abdomen, the vagus nerve, carotid. Like, treatments is as intensive in our clinic. Several $100,000 worth of laser systems in my clinic to get what I believe the right systems. And when I met with Nakamura, we had the same approach. He had been doing it for
That's
10
amazing.
years. Pretty cool, right? That's where there you go back to the coherence code. I believe everything is there. And then we're like filters our brain, and we get to receive it, because it's, you're in LA, a movie comes out and 6 months later, the same damn story comes out, right? Like, it's the same movie. You think they've shared. I think ideas are out there and we just are filters. So I came up with this. He came up with it. I think it was out in the ether, and it gave me confidence because he already had 10 years of data showing it improved. And our acupuncture protocol, although we treat individually, there's a couple of research protocols for inducing ovulation and increasing blood flow to the reproductive system using electrical acupuncture. And I was doing that for most of the patients, with treating them individually based on their pattern. I would add empirical acupuncture for blood flow, ovulation, as did he. So it was like very similar without
That's
different language.
incredible.
So that's how it came. And the next part I like to share is the mechanism why I think it works, and where we're at today. If unless you have specific questions from that.
Well, don't of that yet. I have a follow-up, but I like to know how it works.
So so people call it red light therapy. It's not probably the right name, because we can have, as you know, with your pelvic one, there's blue and there's infrared and there's red. There's yellow, green, different colors, lights. They used to call it cold laser in the day,
Yep.
chiropractors, because it's low level. We're not talking high powered. There are class 4 that are high powered. I'm
I have
talking,
one of those too.
yeah, I'm talking the low level. That's where the
Hmm.
research has been so far. Most of it. There's research on both, but fertility, it's mostly, there are some coming out with the higher powered. It's mostly low level. It's not the one that you go to get hair removed from. It's not the one you do body sculpting with. It's not the one the surgeons use that can cut and burn you. Because these are the questions I get. People like laser, right? And people
Yeah, of
use
course.
LEDs and lasers. LEDs are incoherent light. Lasers are coherent light. Um, it's low level. So the term that was being used that most people know is low level laser therapy. The scientific medical community have adopted the term photobiomodulation. But pretty much cold laser, red light therapy, low level laser therapy, photobiomodulation, we're talking about the same thing. Okay. Um, the mechanism of how or why it works is, first of all, it increases blood flow. So we talked about the soil. Blood is important. Blood to the reproductive system is key. More blood to the ovaries, hopefully more nutrition, more oxygen, more hormones. So better follicular genesis. More blood to the lining, hopefully thicker, richer lining, better microcirculation. One of the main things is it improves mitochondrial function. So as we age, the mitochondria, the batteries of the cells, weaken. And because of that, in meiosis in particular, when the eggs are, when they're doing their thing in meiosis, you can have errors happen and you can get chromosomal errors. So when the egg has to, divide, and the sperm, when it gets fertilized, the chromosomes got to separate and then we rejoin as an embryo. That takes a lot of energy. That comes from the mitochondria from the egg, not from the sperm. And then that embryo to divide in the fallopian tube or to divide in a lab, that takes a lot of energy. So that's the mitochondria aspect. And then to implant takes a lot of energy. That's the mitochondria. So as we age, just the aging process, our mitochondria wear out. So we get aging. Our mitochondria and oxidative stress come up. So the eggs start to have more errors. And that's why we have embryos that are aneuploidy, not normal, and they don't implant or we miscarry. And so photobiomodulation improves mitochondrial function. So that is a very exciting thing, which got me excited. Think of CoQ10, alpha lipoic acid, folks. Think of the NAD supplement craze right now. That's all about supporting mitochondrial function, okay, in the cells. And therefore, less errors in the cell, therefore, better egg, better embryo development, implantation. So very important. So we got blood flow, we got mitochondria. It regulates inflammation. So too much inflammation, there's the noise in the body, and it lowers oxidative stress. So there's that noise where everything looks normal, but yet, you got PMS, you got menstrual pain, you got weird things happen around your cycle, you just don't feel yourself, or you're just unexplained. That could be chronic systemic inflammation, known as inflammaging. So laser regulates that. Here's something really cool. NSAIDs, like the pain meds, they shut down all inflammation, but low-level laser therapy downregulates the bad inflammation, upregulates the good cytokines, the good prostaglandins. So much so, small tangent, you'll like this as a physiotherapist that works in orthopedics. There was a study done that when you give somebody with acute back pain the pain meds, you shut down all inflammation. So yeah, their pain goes away, but these people are at risk of developing chronic back pain because you stopped the healing response. Low-level laser therapy downregulates the bad inflammation. There goes the pain, upregulates the good inflammation. So you still have healing. So you get rid of the pain, but the body heals, less chance of chronic back pain. Same thing for fertility. We do need in our bodies inflammation for healing. We need inflammation, certain inflammation for ovulation, and certain inflammation for implantation. That's why women, if you're doing IVF, or maybe if you haven't heard this, that's why you don't want to take ibuprofen around ovulation or in the second half of your cycle if you're trying to get pregnant, because you could interfere with implantation or ovulation. The laser doesn't shut down inflammation. That's why I purposely use the word regulates inflammation. Down regulates the bad inflammation, up regulates the good inflammation, and helps regulate oxidative stress. So now we have three things that are beneficial for fertility. It's beneficial for perimenopause, menopause. The battery of the cell is loving this. It's been shown to regulate blood sugars. So there's metabolic. That's why I think it's helpful for our PCOS patients probably as well, because of inflammation in the blood sugar. That's why it's probably beneficial for our endometriosis patients, regulating the inflammation. And lastly, that I'm thinking of off the top of my head, I got two more actually, the microbiome. it's been shown to improve gut microbiome. One of the studies done is on Parkinson's, where they used it over the abdomen and the skull, and they showed an improvement in Parkinson's symptoms. And the reason they designed the study is there's this understanding that Parkinson's, part of it is inflammation, but coming from the gut. And so we now know that the gut can interfere with hormonal health, your mood, your skin, not just your gut symptoms, right? And so, and the gut, everything's a system. So if you have a bad gut microbiome, now we're seeing that if there's a improper uterine microbiome, the bacteria, that will infect implantation. So we want to address the microbiome for hormonal health. And that's why I think the Giga Laser, the Denmark group, why they had such good success rate is it's so big. It's over the ovaries, the uterus, but it's also over the intestines, liver. It's over the whole lower abdomen. It's so large. I was like, oh, that's probably why it's also helping, because it's not only helping mitochondria, blood flow, inflammation, but it's getting the gut microbiome. And then the last thing, the reason Ashiro liked his, and later I interviewed him on Healthy Seminars, but I can't remember Kressler. I do remember his name, from Germany. He's a medical doctor who does laser acupuncture. His study was doing laser over the celiac plexus, which the gig is also over. So Ashiro, as I mentioned, did the carotid, stylic ganglia, also the celiac plexus, Ren 12 for my acupuncturist. And that was engaging the parasympathetic response. Kessler's research showed that by doing certain wavelengths, frequencies, alpha and higher frequencies, it engaged the parasympathetic response when he did it over this part, the celiac plexus. So it's also engaging the parasympathetic. And when you engage the parasympathetic, you get more blood flow. That lowers inflammation. That improves genetic expression, because your body's in, I'm safe. So
Important.
so the laser to me was like, this mechanism's crazy. So that's why I went and spent money on lasers and just kept on using it, because there weren't a lot of studies like for it, like, has it worked clinically? There are now, like, there's studies on PCOS, endometriosis. There's a study on it for frozen embryo transfer implantation failure. So genetically screened embryos not sticking, that when you did the laser over the abdomen, improved. I like it on the brain. I use it on my brain and transnasal. It's been used in TBIs and Alzheimer's. And I think the reason I like the brain sometimes for my patients is hypothalamus, pituitary, ovarian axis. So the brain is still controlling a lot of these signals that go to the ovaries, right? And your mood. So it just has so many. And now there's a study that just came out in the Lancet using the laser and using it intranasally, how it affects nitric oxide and for long COVID. And again, tangent, I've only had a handful of my long COVID that have brain fog and anxiety and some neuropathy. But I dress the brain with my laser intranasally and on the skull and forehead, and use acupuncture herbs and high dose of anti-inflammatory type supplements, like, your fish oils, curcumin. And we've seen really good results, like resolution.
And that's really cool because there's so many people and so much more research now coming out about long COVID and POTS and things where everyone's looking for new potential solutions for these things. And if this is a potential, you know, treatment, I think people would be really interested in that.
And
So
then we have the
yes. So this leads me into my next thing. If you don't have a
complicated.
giga laser,
Yeah.
because I don't know anyone who has a giga laser down here, how could people be doing this as part of their programming at home? Or what questions could they be asking of their providers of do you provide a protocol like this?
Yeah. So I do have protocols for home systems, as in, so
Okay.
I gotta give nobody's researched these home systems. So this
Yeah.
is what we think, like, no, like there's, at the time of this recording, so much better. 8 years ago, 5 years ago, like most of the systems online, like people bought on Amazon, aren't good. They're standing in front of them. And, fine, if you're looking for mood and just general inflammation, those may help. But when you're trying to get to the ovaries, because the light has to get to the ovaries and you're really trying to get into the microbiome, basically go stand naked in front of a Christmas tree. Like you're not doing anything most likely, right? Intentionally, maybe you're helping, but I'm not sure if it's doing much. But as of now, so many systems have gotten better, and they've gotten better, and so they've been able to make them so they're affordable for people. Before, if you bought something for $500 online 5 years ago, 7 years ago, so I would say, pre 2020, I would say probably crap, right? Just because, but now you can get stuff at that price and can be okay. So patients come to me with their systems, and then I consult and show them how to use it. There's one company that sells a laser probe. I wasn't sure if you could sell to the public because it's a laser. So people call me, and I have a protocol to how I use it. Bioflex system has a home system. I've created a program around their system, what system to use and how to use it on your body. And then I got introduced to you through Fringe. Fringe has a wrap and a pelvic wand. This is where I'm really interested, and they have a head wrap too, which should be fun, right? There's their
I
brain
have
part.
the head wrap. That's
Yeah,
my favorite thing.
yes. So with this, I'll just a tangent on this story if I didn't share it with us earlier, because I know I talked about it on your episode on my podcast. Is when I was teaching a group of acupuncturists laser for fertility, low level laser for fertility, everything is over the sacrum, abdomen, outside the body. And a reproductive endocrinologist was in the lecture and said, "Why don't you put it in through the vagina?" He goes, "You got the bladder and the intestines and muscles. There's a lot of things in the way." And I had shared, it's hard. I'm not convinced we're getting enough light to the ovaries. It's hard to get that many photons at a therapeutic dose. That's the key. Could you get a photon there? Yeah, one photon's not going to do anything. You got to get a therapeutic dose of photons, which means you need time and power to get the therapeutic dose there. Why the giga laser may be beneficial, because it's got a lot of power, right? So he said, because the vaginal wall, we use this is how we do the ultrasound for the antral follicle count, and how we do the IVF egg pickup, the retrieval. We just have the camera point at the vaginal wall. We see the ovary, and we stick the needle through the vaginal wall and pick up the eggs. He goes, instead of a needle, just have a laser diode on it. And now you'll know where the ovaries are, because the ovaries move around, and you can just have the vaginal wall to go through, and you can get more light to the ovaries. And I said, incredible. This would be great. A physio could do this. Acupuncturists in Canada can't. We can't penetrate the vagina, right? Our naturopathic doctors can, physios can, but it'd be nice to have a home system. So lo and behold, there was many vibrators on the market that had light on it, but there really were vibrators, less medical devices, meaning the light's not going to do anything. It's just a vibrator that lights up. There's my analogy. Go stand in front of a Christmas tree naked with some of these light systems that are outside off the body. But the pelvic wand by Fringe, it's medical grade, and I have a system that can measure photons, and most of the on the market from Amazon that patients bring me, when I try to measure it, I couldn't get a reading from them. But this I do. So I know it's giving off photons. And I've
Yeah.
learned that you helped design this. So maybe this could act as a vibrator, because it vibrates and has light. However, it's a medical pelvic wand to me. And I think of my menopausal patients with vaginal dryness. I think of my endometriosis or pelvic pain patients. I think of my postpartum episiotomy, cuts. And I'm wondering, my patients with vaginal dysbiosis, so the bacteria vaginosis or yeast infections, how this may be affecting the microbiome. And maybe I can get enough light because as Roberta Chow, the medical doctor from Australia, she said, you just want to get a lot of light into the pelvic bowl, and then a cascade of events will happen, right? And so I'm interested how this will work for fertility. And now in Canada, it's like 400 and some odd US dollars, depending on the dollar and tariffs and duty. For Canadians, it comes a little over somewhere in the $600 to $700 range, depending on what the
Yeah.
exchange
It's
rate is.
about 400 here. Yeah.
Yeah, and it's about can be as high as 700 in Canada, and we have them stocked in the clinic, so we don't use it in our practice because it's affordable. And trust me, I have patients beg, saying, "Lorne, please use this," because they want to get pregnant. And I'm like,
Yeah.
it's $500 or $550 in our clinic. You buy it and go home, and it's not a one-off. You want to use this 3 to 4 times a week for fertility. By the way,
Right.
in light therapy, more is not always better. Sometimes less is more. I wouldn't, there's always an exception, but you shouldn't be doing light therapy 7 days a week. But once a week's probably not enough either. It's kind of
Yeah.
that 3 times a week is probably most people get the best benefit. Some people could benefit from 4 or 5, but probably not more in most cases. Some people less. Look, if you have an acute injury, my son had shoulder surgery. We did it 8 days straight. And now
Mhm.
we're starting to not do it every day.
I'm
Right.
assuming with a wrap and not the wand for
Yeah.
your
Yeah.
son.
The son is using the wrap, not the one.
You're
And
like, here, honey, just
yeah, but no, and that's why I have hundreds of $1,000s of lasers. I haven't found one laser to do everything. So I've
Mhm.
mixed and matched my system. So when you come in, I have multiple systems. I only have 1 giga laser, but every other room we have systems that I've for those that are old enough, MacGyver, he was the guy that used to take things and fix things up. I
I loved
basically,
him.
yeah. So I've taken, like most of my rooms are using 2 or 3 laser systems together to do that complete program: vagus, carotid, statellite, microbiome, sacrum. And now I encourage women to pick up a pelvic wand and use it at home 3 to 5 times a week. And again, you can order it from their website. And if you're in Canada, we do bulk orders to keep the price down because they give us a discount. We carry this at the clinic. Again, we don't use it in our clinic, but you can purchase it for home use at the clinic.
So for a home treatment program, if we're using like red light therapy, just like using it as a broad term at home, would you recommend that a woman do front of the neck, sacrum, front of the abdomen, and this about 3 times a week?
Yes, and there's some
Okay.
caveats.
Okay.
So first, front of the neck, you're on it. It's the carotid and the vagus nerve. So it's not so much front, it's the side. Now, some people say, what about my thyroid? So in the books, they say don't put it over the thyroid. In the
Hmm.
books, they say don't put it over cancer cells. They're worried about proliferation, growth. They're worried about if you have a normal thyroid function, it will make it hyper. Now, there has been research since those textbooks are written, but this is still in the textbooks, where they've worked with people with Hashimoto's, and
Hmm.
they're able to go off their meds. It regulated the thyroid. I have
Okay.
worked with a few patients where we do blood draws in our clinic, where because I was new to it, so I was scared, and they had Hashimoto's, so we did a thyroid protocol as part of our treatment. So it's similar to what we do in the neck, but we did a little bit more with the thyroid, and we would do regular blood tests, and all good. Right? I was concerned,
Okay.
but just to let you know, as I'm a doctor, but I'm not your doctor. So you're going to have to talk to a
We
healthcare
always have to
provider.
say that.
This is educational. You got to talk to your healthcare provider. The books say not over the thyroid. There are a couple of small studies showing, okay, I'm not telling you should do it over your thyroid. I just want to be clear. The second part is they say don't put it over a growing fetus. So they say not to do it after ovulation for a couple of reasons. One is we don't know. So nobody studied it. So do no harm, right? Um, Two is when I've asked the experts, because I go and learn from the experts, the researchers, um, they can't think of a reason it would be harmful. But they said when something goes wrong, everybody gets sued. So don't do it over the lower abdomen because we don't know. But they
Yeah.
can't think of a reason. Now, for sure, if somebody had a well-developed pregnancy where the baby can open its eyes in utero, I definitely wouldn't want light over the abdomen because it's infrared light. The eyes don't blink, and you could damage the eyes. That's the whole idea of the goggles, everybody. The
Yeah.
infrared, not the red. If you turn on your device again, you can see the red. You will blink if that was a laser, and that's LED, not laser. You would blink if it was a red light laser because your eye can see it. It will blink. If it was infrared, your eyes can't detect it, and you won't blink, and it could damage your retina. It could damage your eye, right?
Makes sense
So
as I sit here staring at
yeah, but yours are
it.
LED, so you're fine. You'd blink, right?
I
So
definitely was blinking a lot.
yeah, and it's just LEDs are different than lasers as well. It's the laser that I'd be most concerned about. But so over the pelvis and sacrum. So for publicly, no, we use it all cycle long, but we move things around. So in the luteal phase after ovulation, if they're trying to conceive, because some women are single, not trying to conceive, right? Um, or priming or not, there's no chance of pregnancy. We'll just
Hmm.
continue all cycle long. if they're trying, we just change our laser protocol. We're still using the neck for blood flow and regulating inflammation, all that fun stuff, but we're not doing the sacrum or lower abdomen, but we may do the microbiome. So it's up higher in the epigastrium, so navel and higher for the gut microbiome. We may do still the thoracic and upper lumbar because those are what go and innervate the uterus and the ovaries. We just don't put it over a growing fetus.
That makes a lot of sense.
Yeah. So
So,
if you know the tool, you can, like, we from the level of understanding, we know how to use the device. So we think and we adjust based on what's going on with the person and what's happening, because it's not just a plug and play for me. I kind of have an understanding, and I laugh because I speak to experts and I'm like, I know nothing. Just so like, I feel like I know nothing. But from what I know, I have enough to, if you come in, I can ask a couple questions and then know what I want to do with my laser system. But to answer your question, the areas of the body that you want to target are the carotid, the vagus nerve. Um, this is follicular, your sacrum, lower abdomen, so the gut microbiome over the ovaries and uterus, the sacrum. Those are important, beneficial spots.
that's fantastic. I think people are going to be so interested in this. And like you said, we're not neither of us are your doctor, so definitely consult your own. But this is all such new information. There's not a lot of research, but the science is there. So it makes a lot of sense.
For interest. And I do coaching calls. So people from out of town will call and we'll get on, and they have their instrument. Usually they send me what it is in advance.
Hmm.
I try to I have the fringe and I know about the paramedic that people use, the torch and the bioflex. I have to say, I don't know, like sometimes they send me a whole other system and it takes too much time. I'm busy to learn the system, meaning like what's on the website usually isn't enough, and the manufacturers aren't always forthcoming with their information. So it becomes very expensive because for me to go and research and argue with their manufacturer to give me their actual
Yeah.
specs can be hours, and then I have to do the math. So if people coaching call for me, because then I can do it within the hour, and I know it, I don't have to go and do extra research. I'm familiar now with fringe. I'm very familiar with the bioflex PS1, I think the 2080, the white pad or that you have. They have two different sizes, but I'm familiar with that. I have protocols for that. And I'm familiar with the paramedics torch. These are the things that patients tend to contact me, and then I can tell them where to place it, what program, how long, how often.
Well, I think this is a really great place to wrap up. I feel like we could go on for another hour plus about taking this into like perimenopause, menopause, and beyond, but that might be another call.
Part two.
So, part two, if you could please tell people where they can find you. We'll put it all in show notes, of course, but where can people find you if they wanted to have a consultation or do a virtual with you?
Yeah. So I would go to my acubalance.ca website or
Okay.
lornebrown.com. On there, you'll find Instagram, all my social media. Like I have everything personally and podcast wise, everything jumps off there. But if you go to lornebrown.com, LORNE brown.com, that has links to everything, my healthy seminars, Acubalance. And then Acubalance has blogs and blogs on laser therapy for fertility menopause. There's tons. And you can also find all of my stuff there as well. So those two websites kind of have a lot of overlap, and each one has links to many ways to connect with me through LinkedIn, Instagram, Facebook, but give you just two to think about. Acubalance.ca. The CA is because Canada, everybody.ca to help you remember, and lornebrown.com.
Thank you so much for that. And thank you so much for coming on and being a guest with me. We have to speak for another, like a couple of good hours today between yours and mine. So this has been really lovely. I hope you'll come back for part two. And for everyone who's watching, I hope you enjoyed this conversation. Please like, follow, subscribe. You can find us on YouTube and all of your different channels. And with that being said, Lauren, do you have any final thoughts for the audience?
I would share that. Check out the episode I did with Heidi on the Coherence Code podcast, where we talk about menopause and perimenopause.
Well, thank you so much for that. I really appreciate you. And I know you're going skiing today. So
Yes.
please go enjoy the snow for us both.
Thank you very much.
Have a great day. Thank you so much. Now, I have to end with the boring stuff. While I am a doctor, I am not your doctor. This podcast is for entertainment and educational purposes only. If something in today's episode resonated with you, please bring this to your own healthcare team and self-advocate. We always are promoting that. I cannot wait for you to join me on next week's episode of Menopause Unscripted for another hot topic.